Gentlemen, and welcome to the August edition of Ecophilia, the Speakeasy edition. Glad to see you're here. We really give our appreciation to the folks at Jolly's Pizza for opening up special for Ecophilia. They actually closed today at 2 o'clock in the afternoon, so this is all because of us. Really cool. I want to give you a couple updates. I am not Steve Madewell. I'm Harvey Webster, but I'm stepping in for Steve Madewell. As most of you probably have heard that in late June 22nd, Steve was on his way to a gig on a beautiful sunny summer afternoon going down Interstate 90 in his Toyota or whatever his car was, what he called his gig car that had all of his musical equipment in the back. And one of the CD joints gave out on the car, and the car careened into a semi-tractor trailer. And let's just say that his car did not win, and he sustained a lot of damage. 6 broken ribs, a broken sternum, a broken clavicle, a broken scapula, a punctured and deflated left lung, partially deflated right lung, and so he's got a long road to hoe. That said, I had a long talk with him today. He's upbeat, he's focused on his recovery. I saw him at a benefit concert at the Beachland Ballroom where the who's who of musicians from Northeastern Ohio, particularly bluegrass and folk musicians, turned out to perform to benefit Steve. So it's all really good, and if he could be here, he would, and hopefully the next time they meet, he will be here. But he's focusing on his recovery, and so what we like to say is a B team, and that's Rich Benz and Dan Best and I are trying to pick up the slack. So we apologize if we're a little tardy in getting the messaging out about programs. We'll get better, and we're going to be working on getting an entire year's worth of programs. Thank you, Peter Pesch. Peter's looking down on us, reminding us that that is in fact what we're supposed to do. And we will be working on that shortly, so you won't have to guess where we're going to be. However, we seem to like this every other month, the Speakeasy edition and meeting here. So I mean, science is always much better when you have an adult beverage and pizza, right? And speaking of pizza, Howard, our speaker this evening, Dr. Howard Simon, has said that he will pick up the tab for your pizza. So if you haven't ordered a pizza, we're supposed to give the speaker an honorarium. This is the first time the speaker's actually covering all our food costs. Anyway, so that's the update on Steve. One other update, and this is a really sad one, but we learned that we lost Bruce Latimer on July 22nd. And Bruce was a member of this group, instrumental actually in bringing Ecophilia to the Natural History Museum, where we had the greatest run, meeting in the Rare Book Room every month and having a luncheon there. It was the perfect place. It was like the ultimate Ecophilia clubhouse. And Bruce was a world-renowned paleoanthropologist, anatomist, museum director. He was executive director of the Museum of Natural History for 8 years. And unbelievable science communicator, and probably the finest storyteller. He and Clyde would probably have to vie for that. Clyde Simpson right over there, but there were times we would be having dinner parties. It would be the Simpsons, Clyde and Elaine, the Websters, Harvey and Doris, and it would be Bruce and his wife Cindy, and Peter and Donna Pesch. And Bruce would start telling stories, and Peter would be on the floor, rolling around, laughing. I kid you not. It was just so delightful to see the mirth and the fellowship and the joy there. Well, unfortunately, Bruce passed away in late July. And there will be a celebration of life that's coming up on August 27th. That's a Wednesday in the afternoon at 1 at a funeral home whose name I don't recall, but it's right at the intersection of 306 and 322 in Chesterland, just on the south side of the intersection. So If you want to go there and celebrate an amazingly remarkable life, please do so. Now, I would have had normally a lengthy introduction to our speaker, but Howard gave me nothing. So, don't worry about it. I'll tell them all who I am in my talk. So all I can say is, give it up for Dr. Howard Sullivan.
So, some of you may have been here 2 months ago at this venue and heard a wonderful talk by Pat Belter. And Pat talked about Little Mountain, the highest point in Lake County. And the talk was remarkable in that Pat posed 37 questions about Little Mountain and proceeded to answer them all. And I just want to let you know that this is not that kind of talk. So later on in the talk, I will pose one question and I won't be able to answer it. So you can look forward to that. So my name is Howard Simon, and I graduated from Cleveland Heights High School in 1960. And when I was in high school, I decided I wanted to become a physician. And went to college, and after a football game in my senior year, I came home in October and found an acceptance from the University of Cincinnati, one of the high points of my life, actually. And went to the University of Cincinnati Medical School and graduated from there in 1967. And I trained, then I came back to Cleveland and trained at Mount Sinai Hospital. And I did my internship year there, and then I went into the service and spent 2 years in the Air Force during the Vietnam conflict. Came back and finished my residency both at Mount Sinai and then at university hospitals. And applied for and got a job with Kaiser Permanente in Cleveland. Kaiser Permanente was here for about 32 years. As most of you know, Kaiser Permanente is a health maintenance organization, and I was there as a primary care physician. And the primary care physicians at Kaiser took care of the patients in the office, and then they took care of their own patients when the patients were hospitalized. And sometimes they were hospitalized at their small hospital, and sometimes they were hospitalized at community hospitals. And Kaiser, the people at Kaiser asked me to obtain privileges at Mount Sinai Hospital because I had trained there, and it would be easier for me to get privileges. And I applied for it and obtained privileges in the Department of Internal Medicine. Now, in the Department of Internal Medicine, there were no CME requirements in those days. And the department wanted to be sure that their physicians were keeping up to date. So they had a meeting every Wednesday called Medical Grand Rounds, where they had a speaker come and present a topic of interest to help the staff keep up with the developments that were coming in medicine. And I'm going to talk to you about one of those talks that I went to at Medical Grand Rounds. So in my job, I would go to the hospital first thing in the morning. I usually get there about 7 and see my patients in the hospital, and then I would go to the office, and my first patient was scheduled in the office at 9. Medical Grand Rounds at Mount Sinai started at 11, so that I would have my patients cut off at 10:15 and finish about 10:30, which gave me time to get to Mount Sinai and get to the talk. And at the talk, they would give out a syllabus at the beginning and introduce the speaker. And the talk that I'm going to talk about, I didn't have a syllabus, and I didn't remember the speaker, and I didn't know his credentials. And it's my suspicion that I got there late, too late to hear the introduction to the speaker, and too late to pick up a syllabus. But the talk was a fabulous talk, and I'd like to just talk to you about that. So the talk was about improperly fitted shoes and the effect of those people.
I didn't remember, sorry.
No, that's fine. So the talk was about shoes and foot pain. And the reason that this talk was so important to me was the prevalence of foot pain in the community. So if we look at the Cheshire Foot Pain and Disability Survey, 9.5% of 3,417 people in England contacted at random through a postal survey reported that they had disabling foot pain. In the Northwest Adeline Health Study, 17.4% of 3,200 people in Australia contacted at random by phone had pain, aching, or stiffness in either of their feet most days. And in the Framingham Foot Study, 25% of 3,378 residents of Framingham, Massachusetts, who completed the foot study reported the presence of generalized had generalized foot pain on most days. So, as a primary care physician, people coming to see me who were complaining of foot pain was a very common occurrence. And so, this talk was about 1975, and for several years before, I had been seeing quite a bit of foot pain in my office, and actually I saw quite a bit when I was in the service also. And to be very honest, I don't remember what I did about it back then. My suspicion is that I treated foot pain the same way I treated most pain in the early 1970s, and that was with aspirin. So, I don't remember who the lecturer was, I don't remember what his credentials were, and I don't remember what he said. But what I remember is what I did. So, based on what I did, I went back and thought about what he must have said. And what he must have said was that many people wear shoes that are narrower than their feet. The narrow shoes cause deformities in the toes that are easily seen. Narrow shoes lead to pain in the feet, and this is probably the leading cause of foot pain. And in people with foot pain and signs of the toe deformities caused by narrow shoes, switching to wider shoes can alleviate the pain. So here's a foot. Now, how many of you think that this is a normal foot? So, if we take a look at this foot, it's exemplary of the deformities that the speaker talked about when he gave that lecture. So if you look here, you can see that the first toe is sneaking underneath the second toe and raising that second toe off of the plane of contact with the floor. And the third toe is kind of sneaking under the second toe also. The fourth toe is kind of adjacent and butting into the third toe. And the fifth toe is really deformed and is kind of sneaking underneath the fourth. So this is not the only deformity that he talked about, but I would say that this is probably the most common deformity that I saw in the office. And believe me, I didn't recognize this until I heard this talk. So what would happen in my office then would be that a person would come in and complain to me of foot pain, and I would ask them to take off their shoes and socks and look for deformities such as this in their feet. And if I saw deformities of this nature, I would place a piece of paper on the floor and have the person step on that piece of paper, and I would draw a line around their foot, and then I'd put their shoe on top of that outline of the foot, and point out to the person that there's evidence that the outline of the foot is going outside the boundaries of the shoe, and this was a good indication that their shoes were too small for them to wear, and might very well be the cause of the pain that they were having. And interestingly enough, this was a fairly good discussion with the patients. We'll wait for the pizza here.
Who else had around to say? Okay, show me.
So, and basically, as a rule, the patients would accept this advice, and when they return to see me at a later date, one of the great things about being a primary care physician, they would report back to me that they had indeed gotten wider shoes and that their feet felt better. And basically, this is what I did for probably close to 30 years in my office, was in seeing patients here and elsewhere, was to just take off their shoes, look at them, look for deformities, and talk to them about getting better shoes. So things, we closed our little hospital where I was seeing patients and went to St. Luke's Hospital to admit our patients. And as time went on, I noticed that people were coming to me from other physicians and from podiatrists and from rheumatologists with the deformities that I'm talking about, and they hadn't been recognized as deformities, and they hadn't been advised to change their footwear. And I decided that I would go back to the Grand Rounds format and present Grand Rounds at St. Luke's and talk about the things that had been mentioned to me many years before at Mount Sinai. And I went to the librarian at St. Luke's and asked for a literature search on this topic, and found that there was almost nothing written about this. And I gave up the idea of giving Grand Rounds at St. Luke's. Kaiser fell on hard times. They offered me a buyout, which was very delightful, and I took it. And went back to work for Kaiser full time, and then when their lawyers decided that they couldn't pay me and also provide my retirement funds, that I couldn't work there anymore, and I got a job at Metro Health, working in the medical clinic, doctoring the residents part-time. So I had some time, and I had made friends with Peter Pesch. I don't mention Peter Pesch, but if you knew Peter Pesch, then you knew Peter Pesch, And if you didn't know Peter Pesch, then you can't possibly know Peter Pesch, because he was just such a remarkable person. So Peter was the head of the anthropology, of the astronomy department at Case Western Reserve University, and the head of Ecophilia. But Peter was also a fabulous ice skater. And that's where I met Peter. My wife and I joined the club. And this was a social club where we ice skated. And we met Peter and his lovely wife Donna, who were both wonderful skaters. And when Peter learned that I had some free time during the week, he asked me to join Ecophilia. And as Harvey has mentioned, we met in the rare book room at the Natural History Museum for lectures every Tuesday at 10 o'clock. I would go to grand rounds at the Cleveland Clinic at 7:30 and then take a walk and then head over to the Natural History Museum at 10 o'clock for these wonderful lectures. And the thing about Ecophilia was to join Ecophilia, you had to promise to give a talk. And that's all there was. You just had to promise to give a talk. Okay? So I was freeloading for about a year. And Peter came to me and said, "Howard, it's your turn." And I said, "Well, okay, Peter." He said, "What would you like to talk about?" And I said, "Peter, I'd like to talk about politics and opera." And he said, "That will not do. You've got to pick another topic. You've got to talk about something scientific." And I racked my brain, and I'm thinking about feet and shoes and the fact that I couldn't give grand rounds at St. Luke's. And I said, "Peter, I'm going to give a talk about feet and shoes." And Peter said, "Oh, okay." He said, "I know somebody at the university who's interested in feet, and I'm going to give you his phone number." So I called him up. I can't remember his name. God bless him. And we agreed to meet for lunch at the restaurant at Fairmont and Cedar, the bottom of Fairmont Hill. And I can't remember the name of that restaurant. No, not Nightown. It was on Fairmont. Mad Greek, maybe?
Mad Greek.
We met. We met at the Mad Greek restaurant, and I came with some papers and explained to him what I thought the pathophysiology of all of this was. That the fifth toe is the most is abnormal the most, and maybe that was the cause of in some way the cause of this pain. And he looked at me and said, "The fifth toe is of no consequence at all. The first toe is where it's at. You need to go and go back to the drawing board and figure out what you're going to say." And so I left the restaurant, drove up Cedar. We live in Lyndhurst by Cedar and Richmond, and thinking about what I was going to do when I got home. And I decided that I was going to do a search on the internet. So that's what I did. I went home and looked at the internet and looked about an article that might talk about people who were barefoot and people who wore shoes. And the first article that came up was this article from Phil Hoffman, an orthopedic surgeon in St. Louis, in the American Journal of Orthopedic Surgery on October 1905. And the title of the article, "Conclusions Drawn from a Comparative Study of the Feet of Barefooted and Shoe-Wearing People." Ample opportunity for the study of feet of individuals that had never worn footwear was furnished by the Philippine exhibit and by the Central African or Pygmy group at the Louisiana Purchase Exposition. Such studies were made on 186 pair of feet. So this was the 100th anniversary, and it was actually it was in 1903, the 100th anniversary of the Louisiana Purchase. And Dr. Hoffman compared these two groups of people who were barefoot all their lives to his patients in St. Louis. And it was a really remarkable tour de force of a study. He did casts of every person, plaster casts of every person that he studied. And then I'm going to read you the conclusions that he came to at the end of the study. The lasts over which the footwear of civilization is shaped are rarely modeled in the spirit of truth that would make them conform to the contour of a normal foot. The whim of society and the manufacturer's enterprise alone regulate their shape. Society apparently agrees that the human foot, as formed by nature, is coarse, vulgar, and unsightly, and that its width, especially the toes, is entirely too big. It regards the small, especially the narrow foot, as the beautiful one. The dictum of fashion has greater influence than reason. Perhaps the statement that society admires a small foot is not exactly true, for society as such never sees the naked foot. But what it so commonly does admire is the dainty little shoe that hides its own handiwork, the distorted, cramped, callous, and repulsive foot. Here, beauty is less than skin deep, or the most lies no deeper than this calf-skin product of the cobbler's art. The manufacturer, through ignorance and self-interest, fits the desires of his patrons rather than their feet, and places upon the market footwear that more or less crowds the front of it. I read this conclusion and I said to myself, I said, self, you've got to talk. So let's take a look at, so I'm going to talk a lot about normal, because I'm going to talk about normal, but first I'm going to talk about natural. So let's take a look at a natural foot, the foot that Dr. Hoffman was comparing his patients to.
Wow.
So how many of you think this is a beautiful foot?
Look at that, wow.
So what's the difference between this foot?
Don't be shy about the microphone.
What's the difference between this foot then and a normal foot? So,
Wow.
if you take a look at the natural foot B and compare it to the normal foot A, and I say normal because it's the norm. This is the foot that most people have. It's the norm and therefore a normal foot. So, if you look at B and compare it to A, if you take a line from the tip of the first toe and draw that line through the base, the middle of the base of the first toe, that line will pass through the heel in the natural foot. Whereas in the normal foot, that is definitely not the case. If you look at the width of the maximum width of the foot, in the natural foot, it goes from the side of the fifth toe to the side of the first toe. In the normal foot, the greatest width is over the metatarsal heads. So, this foot, by the way, is from a young person who was also part of this group, but had been wearing shoes for a few months in Africa before they, or the Philippines before they came. I'm not sure where they were from. So how long does it take to deform your feet? So these are foot impressions and tracings of badly children, showing the effects of a few weeks of shoe wear, A and C before and B and D after shoe wearing. Note narrowing of the front of the foot and changes in direction to the long axis of the big toe. These children were 8 and 12, and it got cold, and they decided that they needed more protection from the cold that they were getting, so that they started wearing shoes several weeks before these. So these are the impressions that were done when they first got there. A and C were impressions that were done before they started wearing shoes. You can see that a line from the tip of the toe through the base of the toe goes through the heel. And the other, and the older child, the same. And then just after a few weeks of wearing shoes, you can see that that's no longer true. And the width of the foot, similarly, if we look here, the width is greatest over the toes, and here the same person, the width is now greatest over the metatarsal heads. And this happened within a couple of weeks of them beginning to wear shoes, and Dr. Hoffman noted that this was not accompanied by any discomfort. They didn't have discomfort from the fact that their feet had been deformed. The discomfort comes later. If you wear ill-fitting shoes for a long time, this is going to be what happens to your feet. They just take on the shape of the shoes, and this is pretty much a fixed state. The surgery would be required to change this. So I thought to myself, well, okay, there's a change in the shape of the foot, but why do people have pain? What is that? What is the cause of the pain? So the next paper, this is the same day. I talked to the guy at the restaurant. I came home. This is the first paper I saw, and I said to myself, well, what's the difference? How is one foot different than the other, and how would that be physiologically causing some discomfort? The very next paper I got off the internet was this one. The journal Footwear Science, and if you'll notice, this is volume 1. This Footwear Science. This is the second issue of Footwear Science ever, in June of 2009. And the article is the effects of habitual footwear use, foot shape and function in native barefoot walkers. And the authors, this is Dr. Christian de Hout, and he was from Belgium, and was a professor and worked in movement and sports sciences at the University of Ghent in Belgium. And what Dr. de Hout did was he had 3 groups. A group of people from Belgium, and then he went to India, and he studied 2 groups in India. A group of people in India who had never worn shoes, and a group of Indian people who sometimes wore shoes, and I'll go over in just a second what that group consisted of. The question that he asked is the Western foot used in most studies not natural anymore? And is our current knowledge of foot biomechanics clouded by the effects of footwear? In other words, are we studying the form, but not biologically normal feet? The use of footwear remains necessary, especially on unnatural substrates in athletics and in some pathologies, but current data suggests that footwear that fails to respect natural foot shape and function will ultimately alter the morphology and the biomechanical behavior of the foot. I can't tell you how thrilling it was have two articles that one explained to me exactly what was happening with people's feet and why there were deformities, and the next one to go over what the problems with those deformities were. But it was my good fortune. And what Dr. Duke did was he took a pressure plate, put it on the ground, and then he had his subjects walk over the pressure plate, being careful that they were walking at the same rate of speed, and their walk was similar in all three groups and in all of the people. Here's the barefoot, the representative of the barefoot Indian group. You can see that the foot is very similar to the foot in Hoffman's article, a line from the tip of the toe through the base of the toe goes straight through the heel. This is the widest part of the foot. The other group were shod Indians who sometimes wore shoes, and it's pretty much like the first one. The shod Indians were originally shod Indians from Bangalore and nearby rural areas. These subjects use footwear on a daily basis. It should be mentioned that these subjects, according to Indian habits, have walked mostly barefoot as child, and all subjects reported walking barefoot in the house. Outdoors and at work, they sometimes use Western-style clothes, potentially constricting footwear, but often open flip-flops or sandals. And then the third group this was a group from Belgium, which were designated W. So here's the kind of metrics on the three groups. If we look just at foot length, the Western populations had the longest feet, and the two Indian groups were similar. The shod Indians were a little longer than the barefoot Indians. But if we then look at foot length divided by stature, we find that the Western group now had the shortest feet. In this, if you use that metric, and the p-values were very, so that these were almost no way that this could be by chance. There was very little difference between the barefoot and shod Indians. And again, foot width divided by length showed that the Western group, if you compare them, had by far the narrowest feet in comparison to the length of their foot. Again, highly statistically significant. There's no difference in BMI between the groups. If you looked at the average images of peak pressures for all trials, the BI, SI, and W groups, pressures are expressed as percentages relative to the average of the foot and indicate zones of relatively high or low pressures. So if you look at the barefoot Indian group, when you walk, you stride forward, your heel strikes first, and there's a good deal of pressure taken by the heel, and then weight is transferred over the midfoot onto the metatarsal heads, and actually it kind of rotates through as you're striding from lateral to medial, and then you step off on your first toe, and most of the weight that you bear stepping forward goes from the first toe. And you can see that there's a good deal of pressure on the heel, there's some pressure on the midfoot, and there's a good deal of pressure on the first toe. This is the barefoot Indians. And the shod Indians, if we compare them to the barefoot Indians, we can see that they are taking more pressure on the heel, a little less pressure on the midfoot, more pressure on the metatarsal, over the metatarsal heads, and about the same pressure, maybe a little, it's about the same on the first toe. Now if you compare these two to the Western group, you see that there's a significantly greater amount of pressure taken on the heel. There's much less pressure taken on the midfoot. There's much more pressure on the metatarsal heads, especially in the center of the metatarsal heads. And it looks like there's less pressure being taken on the first toe. If you take a look at the p-values for these differences, so this is barefoot Indian compared to shod Indian, and there really is not a lot of difference between them. If you look at shod Indians compared to the western foot, you can see that in the western foot there's more pressure on the heel, more pressure over the metatarsal heads, far less pressure over the midfoot, and less pressure under the first toe. And if you compare the barefoot Indians to the western group, the differences are even greater, with much more pressure on the heels, more pressure over the metatarsal heads, even less pressure over the midfoot, and less pressure over the first toe. So, could it be then that this physiologic difference between having your toes spread out a little bit more and being cramped is most likely, this was the large difference in the metrics that they saw, is most likely the difference that most likely why there's this difference in the way the foot takes pressure. So, what else is happening to the foot as a result of these deformities? So if you have a shoe that is constantly rubbing against your toes, it could cause blisters. If you have a toe that's lifting a toe up in the air and rubbing against the top of your shoe, you can get corns. If you're taking more pressure over your metatarsal heads, you can get calluses, or have your shoe rubbing against your toe, you can get calluses. But we'll talk about bunions a little bit later, but certainly by deviating the toe laterally, eventually you can end up with a bunion. So after I went to the computer and got these two studies, I went to the medical librarian at Metro Health and asked her to do a literature search for me, and she sent me sheets with about 100 articles, and I picked about 40. And I'm just going to go over just a very few of those articles that play a role here. The other thing is that in addition to those issues, you can have problems with diabetic foot ulcers, and those issues, you can see that diabetic foot ulcers are more common over the areas of increased pressure. And I had several diabetic patients that I was taking care of that had special shoes made for them, and the shoes did not correct the issues of the toes, the shoes not having enough room for the toes of the foot. So here's an article from the Journal of Bone and Joint Surgery written, and this article was done. This study was done in India, and they analyzed the static footprints of 2,300 children between the ages of 4 and 13 years to establish the influence of footwear on the prevalence of flat feet. The incidence among children who use footwear was 8.6% compared with 2.8% of those who did not. P was less than 0.001. Significant differences between the predominance in shod and unshod children were noted in all age groups, most spartan generalized ligament laxity. Flat foot was most common in children who wore closed-toed shoes, less common in those who wore sandals or slippers, and least in the unshod. Our findings suggest that shoe wearing in early childhood is detrimental to the development of a normal longitudinal arch. And there were other studies that showed that shoe wearing in children had not only problems with flat feet, but that there were other problems. There's a society advocating for children going barefoot. I think I subscribe to that idea. So, several studies report a relationship between foot pain and knee, hip, and back pain. And I came across this article in the Medical Clinics in North America from 2009 devoted to osteoarthritis. And Dr. Kenneth Grant states that he believes that osteoarthritis is best defined as failed repair of damage that has been caused by excessive mechanical stress on joint tissues. From a review of the literature, he asserts that data indicates that joint healing in osteoarthritis depends on normalization of intra-articular stress in addition to other factors. So, if we look at osteoarthritis, it's more common certainly in people who are overweight. It's more common in people who have had injuries to the knee, and these people have more stress with weight bearing in their knee joint than other people would. Could it be that shoes cause more stress in the knee joint than going barefoot? And here is an article. Walking barefoot decreases loading on the lower extremity joints in knee osteoarthritis. And Najia Shakur and Joel Block, and this is from Rush University in Chicago. They did gait analyses that were performed on 75 subjects with knee osteoarthritis while they were wearing their everyday walking shoes and while they were walking barefoot. Peak joint loads in the hip and knees were significantly decreased during barefoot walking, with an 11.9% reduction in some parameters. And they felt that shoes may detrimentally increase loads on the lower extremity joints. So 12% seems to me to be a lot. So just taking off your shoes, and what they did was, and believe me when I tell you I don't understand how they did this, they could measure the pressure at the knee, and measuring the pressure at the knee would have found this 12% difference. So what did they think was happening? Maybe heels were too high, and that changed the way the knee was taking the pressure. Maybe there was stiffness of the sole. Maybe there was increased proprioception from skin contact with the bone. So these were the mechanisms that they suggested might be in play. They gave no consideration at all that the shoes were too narrow and the toes spread out and the shoes were removed. Here's the picture that I showed you of a normal deformed foot at the very beginning. This is a teenager. He is a sophomore. He was at this time a sophomore in high school. He ran track. He had missed 2 seasons of cross country. He had an infection in his first toe. He had a stress fracture in his ankle, and he had shin splints. So if we take a look at this person and ask him, so as you can see, this picture is taken with this without weight bearing. This foot is not bearing weight bearing. Now let's ask him to stand up 5 seconds later. You can see a big difference in the way the foot is shaped from the time he took his foot and put it on the ground and he bore weight. Let's look at that again. Here's the foot not weight bearing, and here's the foot weight bearing. So if we look at this foot and imagine that he's got his shoes off, and what would happen if he put his shoes on? I can't tell you what would happen because I didn't measure it, but one would think that his foot would be more cramped inside his shoe and less cramped when he takes the shoe off. And then when he steps and is bearing weight, the shoe becomes even wider in the toes. And perhaps this is what Shakur and Block found. This is the reason that they found this difference in pressure at the knee, this 12% difference in pressure at the knee, because there was a difference in the way that the foot was shaped. The foot was wider, and as we saw from the work of Daoud, the wider foot takes pressure differently than the narrower foot. Could this have been the reason that there was a decrease in pressure of 12% when the person walked barefoot? I don't know the answer to that question. So here's the question these are the questions that I'm talking about. I don't know the answer to that question. I wrote Shakur and Block. I told him exactly what I've told you. And I said, you can do this again and measure how much the foot spreads, how much the toes spread apart. You can do that, measure it, and then correlate that with the pressure findings that you have. And I told him, I'll pay for it. And they didn't ask me. So that's so how long has this been a problem? How long has this been going on? I'll get it right soon. So I went to the Cleveland Museum of Art, and here is Apollo the Lizard Slayer, attributed to Praxiteles or a follower, Greek Athenian, in about 350 BCE. Let's look at his feet. You can see that these feet are deformed by wearing shoes. There's nothing else that causes this. So the first toe is deviated, the fifth toe is deviated, the fourth toe is underneath the third toe. So the model for Praxiteles in 350 BCE, and was wearing shoes, and those shoes were deformed with his feet. Let's go to Roman times. So here's a great male figure. This was stolen from Turkey and was from the Roman era, and it is now in the process of being restored to Turkey. Let's look at his feet. You can see that he's wearing sandals, but there's still deformities of that foot. So in Roman times, even people who wore sandals sometimes wore closed-toed shoes, I guess, and deformed their feet. Here's Christ on the cross by El Greco in about 1600. Let's look at the model's feet. You can see that this person has had great deformities to his foot from wearing improper shoes. Here's a portrait of Lisa Cole Curtis by John Singer Sargent, an American, say, maybe at the turn into the 20th century, and let's look at her feet. So these are the height of fashion at the turn of the last century, and I hate to say it, but they're probably the height of fashion today. So I paid my dues to the American College of Physicians and Group of Internists, and I get the Annals of Internal Medicine on a regular basis to my house. And here we are in 2016, and I think I'm preparing this talk then. And I'm astounded to see this paper, Unloading Shoes for Self-Management of Knee Osteoarthritis, a randomized trial. The objective is to evaluate the efficacy of unloading shoes in alleviating knee osteoarthritis symptoms. The participants, 164 persons with medial knee osteoarthritis, and the intervention was walking shoes with triple density, variable stiffness midsoles, and mild lateral wedge insoles designed to unload the medial knee and worn daily. This is conventional walking shoes. So they thought that they could unload the knee by putting some stuff in the shoe and taking pressure off the knee. The measurements of primary outcomes were pain with walking and physical function at 6 months. Secondary outcomes were knee pain and stiffness, average pain, intermittent and constant knee pain, quality of life, physical activity, and global change in pain and function. So there's these two groups, one with shoes that they made special to unload the knee, and another group, another shoe that looked just like it, but without all of that hardware to unload the knee. What did they find? A total of 160 participants completed primary outcome measures in 6 months. Changes in pain and function did not differ between groups at 6 months, with both groups showing clinically relevant improvements in function and the intervention group showing clinically relevant improvements in pain. There were no differences in the secondary outcome. Pain was globally improved by 54% of the patients, and function was globally improved in 44 to 48%. Unloading shoes were not associated with the increased probability of improvement for pain and function. Their conclusion: shoes with modified midsoles to unload the knee confer no additional benefits over conventional walking shoes. Both improve pain and function by clinically relevant amounts. Their discussion: placebo effects likely explain at least some of the symptomatic benefits of both types of shoes. I've been a doctor for a long time, and I will tell you that seeing placebo effects in 50% of your patients is mighty unusual. Most people feel that placebo effects of 20% are probably what the average is. Interestingly enough, there was no picture of these shoes in the article in the Annals of Internal Medicine. However, they said that you could see the shoes if you went online and looked at the supplement, which is what I did, and here are the shoes. So here are the shoes that give you 50% and 48% improvement in pain and function. These shoes are much wider than the shoes that most people wear. Could they have taken the people who were wearing narrow shoes and put them in these wider shoes and found a 50% increase in pain and function? I wrote a letter to the Annals of Internal Medicine and said just what I've just said to you, and told them about the talk that I've been giving to you. And Dr. Hinman replied to that letter and said, we didn't measure the width of their shoes, and we can't comment on it. So I wrote Dr. Hinman and I said, Dr. Hinman, you could do this. You can do this again and measure it and see what happens. And I never got a reply from Dr. Hinman. Extended the comment. This is from Carol Frey, an orthopedic surgeon, and it was in 1993. I'm not sure it's still true, but it was true in 1993. 88% of women were wearing shoes that were narrower than the width of their feet by an average of 1.2 centimeters, about a half an inch. And those with the greatest disparity were more likely to suffer from foot pain. Most of the studies that I looked at that were sent to me from the library that looked at shoe size only looked at the length. It was very, very unusual for a study to be done and talked about the width of the foot. Carol Frey, bless her heart, was one of the few that looked at this issue. So why is it? Why? So if we look at EBD Hamilton discussing painful feet in the British Medical Journal in August of 1969, here he's talking about palpus valgus, bunions. This is not the place to debate the cause of this condition, which is so common in females, but heredity and incorrect footwear are probably both etiological factors. It is customary here to recite the features of the sensible shoe, which does not constrict and is able to adequately support the foot. When such repetition is made, if the shoe described does not conform to fashion. Is this the issue? Is this why we're not studying how wide toes are? Here's an article, The Normal Foot, by Dr. D. Phillips and Doctor of Podiatric Medicine in the Journal of the American Podiatric Medical Association in 2000. The conclusion of Dr. Phillips, the normal foot should be defined in terms of societal demands. That's what this podiatrist thought, that the normal foot, whatever society says is a normal foot, this is what I've been saying, is a normal foot. He's right. At the beginning of this article, he has this quote from Lewis Carroll. Please look at this. When I use a word Humpty Dumpty said in a rather scornful tone, it means just what I choose it to mean, neither more nor less. So I was intrigued by this, and I went back to my trusty computer to see what this conversation was about. And only one for birthday presents, you know, there's glory for you. I don't know what you mean by glory, Alice said. Humpty Dumpty smiled contemptuously. Of course you don't, till I tell you. I meant there's a nice knockdown argument for you. But glory doesn't mean a nice knockdown argument, Alice objected. When I use the word Humpty Dumpty said in a rather scornful tone, it means just what I choose it to mean, neither more nor less. The question is, said Alice, whether you can make words mean so many different things. The question is, said Humpty Dumpty, which is to be master? That's all. So who's the master? Is it Christian Louboutin, whose undeniably sexy shoes with their signature red soles has established him as one of the best-known footwear designers in the world? Perhaps. But this is not just a problem for women. Look at these shoes, these men's shoes. Nobody can get into those shoes. So, and here's the thing with these shoes which you buy online. Men's width, D medium. These shoes don't come in any width except this one. That's it. And in this case, one size fits no one. So in sum, these are the feet that nature has bequeathed upon humankind through the wonderful method of, this is, Darwin said it, and I'm going to block the very end. Natural selection. These are the feet that were given to us by natural selection. And what has happened is that humans have developed a sixth sense, and that's the aesthetic sense. And they have said that the feet given to us by natural selection are not good enough. You need to have a foot that looks better. And they have determined that they need shoes that are much, much narrower than the foot that we were given by natural selection. Why is it that there's no research being done to look at the effects of these abnormal feet on hip pain, knee pain, shin pain, ankle pain, foot pain? Why is that? I can't answer that question. Happy to take any questions. Oh wait, one more slide. This slide is a cartoon by Walt Kelly. And Walt Kelly drew this cartoon in honor of the first Earth Day in 1971. And I have usurped it to end this talk. Any questions? Yes, Pat.
Howard, this is more of a comment than a question. I'm on the board of a group called Burroughs Nature Club. They've been meeting for 110 years to talk about natural history. And I've tried for years to get Howard and this talk on the agenda. Of course, I'll be next time. But they don't want Howard. Not because of them personally, because they see this as too medical and not sufficiently natural history. Well, in one of our natural history talks, this very topic came up by default. A couple went to the wilds of Borneo to photograph birds of paradise in the wild. They were passionate about this. And that was an adventure in itself. A very rugged area, up and down, covered with the rainforest with a thin layer of slippery mud. They hired 2 guides to take them into the forest. During this trip, they must have slipped and fallen 100 times. Their guides never fell once. Okay? And they said, what are they wearing? Well, they weren't wearing shoes. But they said they both suffered from the same deformity, even though they weren't related. Their toes were splayed and straight. And here's the point, Howard. It not only helps your bones, your ligaments, your tendons, your muscles, your skeletal system. Splayed natural feet are great traction, kind of like Michelin all-weather tires. You can just go through it.
They're what was given up to us by natural selection. This was selected. Yes.
So in that vein, what I was wondering is, there are fossilized trackways. I know there's Australopithecine, so that's before us, but are there fossilized trackways that show splayed toes, that show natural?
I have another. I have this talk which I took that slide out of. I have an earlier thing that I can show that to you. I think so. If you could help me out.
You have to shut this one down.
Howard, I have a question for you.
Yes.
What footwear are you wearing?
So this is a very interesting question, and I appreciate it. Thank you, Harvey.
Howard, can you use a mic?
So I chose to wear my tennis shoes that I wear in the gym today because the other shoes that I'm wearing are falling apart. So they're a little wider than these. But the point is this: once you have deformed feet, they're deformed. If you take your insole out of your shoe and put it on the ground and put all of your weight on your foot, and it doesn't go outside that insole, your shoes fit. We're not going back to splitting toes. That's not going to happen. So if you put your foot on the ground and it fits inside your shoes fit. And it's much easier than drawing a circle around the foot as I did before. So once we're at this age,
But do you walk around barefooted at home?
yes, absolutely. I never put my shoes on. Never.
Which one?
Okay, so it's the same one.
Oh, nice.
Okay.
You can spread it out.
Let's see.
Yeah, on.
See,
And
while
this
they're-
is this
while they're,
circumcision, or is
Yes.
this?
looking
Yes.
this image up, one thing that's interesting is that Bruce Latimer, who was a member of this group, and whose life we mourn since he passed away in July, but his specialty was the evolution of the foot. And he was the one who actually described the foot of Australopithecus Lucy, and was part of the group that described the foot of Australopithecus. And one of the differences between Australopithecus ramidus at 4.2 million years and Lucy is that Australopithecus ramidus, though suggesting from the hip skeleton's getting modified to accommodate upright walking. By the time you get to Lucy, Bruce's analysis and everyone else's analysis demonstrated that she was a habitual rider. She was set for, she might have had long arms and wings, she perhaps was a great climber. Basically, from the hips down, she was set for bicycle walking. And there are trailways Arcturus occurrence, Australopithecus occurrences, but not totally.
This is Homo sapiens. So these footprints were found at White Sands. I think that's in Nevada. And this is a fascinating story. We had, do you remember the name of the guy who dated things by pollen? We had a guy in Ecophilia-Dr. Do you remember his name?
Paleontologist Jim King was director for a while. He did archaeology. He wasn't a paleontologist.
Dr. David Charson is.
There you go.
Thank you. So they date things by looking at the pollen and saying how old this plant was. So these footprints were found in White Sands. So these were human footprints, and they dated them to 23,000 years ago. So there was an article in the online, a big to-do about people have been here in America a lot longer than we thought. But if you take a look at these footprints, so these people are not wearing shoes, and you can see the displayed toes. Yes?
This a wonderful talk and very nicely done. There's another body of literature that might be relevant, and that is the shock of the American missionaries in China at the binding of feet. And did anything come out of that kind of study?
So this is, this foot binding. It's worse than just grabbing the feet. They broke the bones of those women. Their feet were just like little pegs. And why did they do that? It's thought that they were, that the walk was more sexually stimulating or something. I don't know. But you look at so I saw an article which questioned whether Cinderella came from Chinese foot binding. So there's this entire history of people just lusting after little teeny feet. Why? It's just really hard to understand.
They can't run away.
They can't understand that. Yes.
So I have another question. If you go back to your very first slide with deformed feet, mine are way worse than that. As is one of my sisters, as was my mom, as was my grandma. They were worse and worse, so I understand that grandma had worse shoes than I did. Is there a hereditary component?
Well, that's what
You hinted at it,
I
like just the
hinted
one
at
slide.
it, yeah.
Right.
I don't know the answer to that.
Right.
There's controversy. Some people think it's all hereditary, as far as bunions are concerned, that it's all hereditary, and some people think it's all shoes, and some people think it's somewhere in between. I really can't comment. I really have no idea.
Okay.
Any other questions?
Well,
Yes.
if you think of feet that have the possibility of the toes can move, they can move, and I think those guys got much more movement in their toes than people who have wide shoes. The wide shoes guys are not going to be having good feet the way a barefoot person
Right.
has.
Exactly. Yeah.
So Hoffman commented on this in his article. He talked about the flexibility of the natives who had been barefoot all of their lives, how they could pick up things with their feet, how they could climb trees better. It was very, this is a big part of his article with regard to the flexibility of the foot of barefoot people as opposed to people who wear shoes.
And of course, Nika grew up wearing wooden shoes.
Oh, my.
And then, of course, you started with the skaters, The real Frisian skaters had no shoes on, just socks on their skate. And they were the fastest, and then they started to having shoes on. But those feet were muscular too. It's wonderful to have muscular feet.
Hoffman's article is probably available still online. Daru's article is not, but I think you may still be able to read it. It's an interesting read because he goes over this in detail, the flexibility of the foot of barefoot people. Other questions? Thank you very much.
Thank you, Howard. That was brilliant. And I'm examining my feet right now. They don't look good. Hopefully it's not Lamarckian and I haven't passed this on to my children. So, what a great program. And this is the essence of what Ecophilia is all about. Great science, asking fabulous questions.
So I forgot to talk about that.
I'll take a seat.
Because I will tell you that this experience has been so beneficial to me. And think about it. Is there something that you're interested in that you don't know enough about? Sign up with Ecophilia to give a talk about it, and then you go and figure it out. I mean, I can't tell you how thrilling it is to start off thinking about people who have foot pain and end up asking the question, can we improve arthritis by widening our shoes? You know, I mean, this is just, it's a thrill. And I urge you to think about this and think about something that you're really interested in and prepare to talk about it because it's really a wonderful experience.
Great segue. That's exactly so. We are looking for speakers. So Rich, Dan, and hopefully Steve will be part of this as well. We'll be meeting sometime very soon to start planning a year's worth of speakers so that we're not quite last minute, and we apologize for that. But if any of you have a topic that you're passionate about and you'd like to share, I mean, Howard did today, Pat did it 2 months ago, you know, we encourage you to do so. This is just a lively group, and we just love, you know, to do a deep dive. Oh, Rich.
Yeah, and along with that, we've built in some options now. If you think this is great, with people having a beer in hand and pizza in the other hand, in a nice intimate environment, this is wonderful, then you want to come on an odd numbered month and have the Speakeasy experience. On the other hand, if you have a talk that you maybe already prepared, you have it on your computer disk, and you think it would be interesting for other people to hear about, but you don't want to leave your house, we can do a Zoom, and we'll broadcast it to everybody, both the Zoom and, as you can see me playing with my phone over here, the Speakeasy version. I'm recording those and I'm putting them on YouTube so that all of you can see them again. You can share them with your friends, share them with your communities, or not. I mean, if you don't want your talk on YouTube, just tell me, and then that makes it easy for me. But we put them on YouTube so that these are archived, but more importantly, so that they're not gone and people can share them. And we're finding that there's even retirement communities that are using our YouTube videos to have a Tuesday evening discussion. So, you know, that just makes it beautiful. So if you have a talk that you want to tell us about in person, we got you. If you have a talk that you want to stay in your house and you want to just let it out there on a Zoom talk, we got you there too. So please, and in addition to that, maybe you don't have a talk, but you know somebody that does.
I know somebody.
Yeah, I mean, I've had my daughter give a talk. She's a genetic counselor, I've had one of my former students give a talk, he's an astronomer. And then I gave a talk, and I competed with the band at the Jolly Scholar Brew Pub. I had to talk really loud, we actually had to leave the room and find a corner, but I still did it. So we're looking for as many inputs as we can to keep Ecophilia alive and well.
How can you resist an invitation? This is a really lively group, and we hope to see more of you. And before we close up this edition, I'm going to take the microphone and I'll walk it over to Clyde Simpson, who has a few words to say about Bruce Lee. Right?
Bruce was a really good paleontologist, and he had scores of publications for which he was the author or co-author. And one of his early publications, he was on the original team describing Lucy, and as a graduate student, it was Owen, right, that assigned the different parts of the skeleton of Lucy.
I think Don.
Oh, Don Johansson, yeah. And, since Bruce was just a graduate student, they decided that we're going to give you a part of the skeleton that nobody's interested in, because everyone wanted the skull. No. So Bruce got the ankle joint, which turned out to make him one of the, ultimately, since they found out that Lucy was bipedal, one of the world's experts on human locomotion and almost undisputed expert on the evolution of the ankle. One of his early papers, I remember he was kind of pleased, got published, and he managed among his citations to cite an author named T. Geisel, and the book that he was citing was called the Footwear. And it got through all of the peer reviewers. And it turns out that, you know it, don't you? T. Geisel is Theodore Geisel, better known as Dr. Seuss. The Footbook is a children's book. You got it in the publication. So that's the kind of person that Bruce was, besides being a fabulous scientist and a good friend of all of us.
And a stalwart member of Ecophilia, and gave us all home for a long period of time. Okay, I think that concludes the August edition of Ecophilia, the Speakeasy edition. Thank you all for coming out, and we hope we see you next month. Next month will be the morning version, second Thursday of the month, and then the next Speakeasy would be in October. So anyway, thanks for coming out. Really appreciate it. And thank you, Howard, for the pizza.